I'm Rich Burkett, your host of the Free Skeptic channel. The title of this video is Evidence of Free Will and Loss of Free Will. Assuming free will is possible, free will is most evident when possible options are abundant and or closely preferred. Examples in this video include writing, menus, games, shopping, testing, voting, unethical options, and during involuntary constraints. Writing. Few or possibly no other activity offers more abundant possible options than writing. Choosing which words and the order of the words could involve thousands of word and word order options to choose from. The English language has over 1 million words. Most writers know tens of thousands of words. Most words have multiple synonyms. I've seen words that had over 20 synonyms. So a lot to choose from there of closely preferred options. Okay, this is an example of all the writing, the multitude of writings. There's probably multiple millions of word options and word orders among all these books. Robert Sapolsky and Sam Harris, both well-known free will skeptics, have written books full of thousands of words. Robert Sapolsky's book, Determined, is over 700 pages containing over 100,000 words. Sam Harris's book, Free Will, is only 83 pages containing approximately 15,000 words. And here's their books. Writers and editors are able to add, change, and delete words and change word order of previous versions. Writing and editing could involve many times more choices and decisions than the final, that is, the latest or published version, the final number of words. The probability that free will had no role in choosing and editing all words and word orders is very low to none. The impossibility that free will had a role could be more difficult to ascertain or determine. That's an odd statement, but it came out of whether it's possible that free will had no role. So I'll let you interpret that yourself. Menus. Most restaurants offer dozens of menu options to choose from. Diners could order none, one, or more menu options up to all menu options. Diners could order many menu options together or at different times. Diners' choices could be influenced by familiarity with the menu and food. Returning diners could order options they've tried before and preferred enough to order again. Games. Chess and many card games, including bridge, poker, solitaire, and other offer abundant possible options. Games' possible options are constrained by agreed to rules. In chess, both whites and blacks' opening move has 20 possible options. Subsequent moves, possible options, are further constrained by opponent's previous move. A player can only predict the probability, not the certainty, of opponent's next moves. Shopping. Large retail stores offer multiple thousands of purchase options. Shoppers could buy nothing, one thing or more, or everything now, later, or never. Options could include multiple identical items. Options could include other closely preferred items when the first preferred item is unavailable. Other abundant shopping options include housing, buying a house, looking for an apartment to rent. Transportation is, buying a car or a truck, or other options. Communication, as many choices of cell phones and different kinds of phones. Entertainment, food, drinks, and many others. Testing. Essay tests include the same abundant choice of words and word orders as writing mentioned earlier. Most multiple choice tests have rules that constrain choices, like one and only one choice is correct, and no choice or more than one choice is always incorrect. If a test taker knows no choice is always incorrect, then the test taker could, randomly or not, choose one choice that would have a probability of being correct of 1 over the number of choices. That's if you had 3 choices, the odds of being correct are 1 in 3, which is always greater than the 0 correct of no choice. True or false tests are 2-choice, multiple choice tests. None or both are incorrect. Medical testing includes randomized, double-blind studies to determine drugs and medical treatments' efficacy and safety. Voting. Voting has evolved from handwritten paper ballots that were counted by humans to voting machines that collect and count votes. Voting systems vary how votes are counted, constrained, distributed, and outcomes determined, such as one voter, one vote. Only one or no more than one, or how many vote for each office. Now, there could be circumstances where there are multiple elections of officers from a list that could be no more than whatever number of offices are being voted on. Okay, we also have write-ins. We have winners by majority. Polarity. Majority means more than 50%. Polarity means you just got the most votes, whether it's 50% or not. And then runoff votes are an instant runoff and proportional representation. Runoff votes and instant runoff votes is if there's not a majority in the first round of voting. Okay, also partisan primaries, nonpartisan primaries, ranked choice voting, direct voting by proposition, initiative, referendum, and recall. So you can see there's a lot of possibilities when it comes to voting. Okay. Unethical options. Someone could observe, learn about, and or become aware of others' choices, decisions, or actions and their consequences. Someone could assess the ethics and legality of the actions and recognize and or know some actions are unethical or illegal. The probability that someone will take an unethical or illegal action is affected by the lack of awareness of ethics or law and or the willingness to take knowingly unethical or illegal actions. A thief and children is more likely to steal or steal again. During involuntary constraints. Involuntary constraints could be external or internal. Physical external involuntary constraints include gravity, captivity, confinement. Physical restraints include handcuffs, straitjackets, muzzles, and leg restraints. Internal or interpersonal involuntary constraints include inevitable, unavoidable, and irresistible biologically necessary actions, including breathing, eating, hydrating, sleeping, urinating, and defecating. Breathing is unique among involuntary biologically necessary actions because, 1, the ability to consciously change breathing, including holding of breath. I can hold my breath, okay. Slower or faster inhales or exhales. Or breathing through the nose or mouth. Coughing. Vocalization such as talking or singing. Blowing or exhaling by whistling or wind instruments. I have a whole list of wind instruments here. What's interesting is the talk box. That's the tube that Peter Frampton's used to talk through his guitar. Very interesting, okay? And blowing bubbles, blowing smoke, candles, blowing candles out, blowing balloons up, sucking or inhaling straws, siphons, smoke, cigarettes, and pipes. 2, breathing continues while sleeping, unconscious, comatose, and rarely after brain death. And the reason I say rarely is because most patients that become brain dead are usually on a respirator or a ventilator or some kind of life support. So when the decision is made to let the patient die, they'll usually disconnect the ventilator or the respirator. And most times, the patient, if brain dead, will stop breathing and die. But rarely, there's an occasion where patients will continue to breathe even though they don't show any brain activity. Okay. Breathing is part of the autonomic nervous system that also regulates heart rhythm, body temperature, reflexes, digestion, immunity. And I say immunity because there's some evidence of indirect involvement of immunity into the nervous system, not directly. And this could be for autoimmune diseases like multiple sclerosis. Okay, blinking and possibly consciousness, thoughts, and agency. I'm going to do a video on the possibility that consciousness, thoughts, and agency are a part of, at least part of the autonomic nervous system. Okay, so to summarize, number one, there's a wide range of discretion and choices and decisions and actions during or between eventual, unavoidable, inevitable, irresistible, involuntary breathing. Eating, water, hydrating, and sleeping all could be consciously delayed for days to weeks. Now, only the not eating can go on for weeks. Well, sleeping and eating can go on for weeks, but going out without water can only go on for days. If eating or water hydrating is delayed too long, then the inability to eat or drink could be fatal if unassisted by other people bringing them back to consciousness. If sleeping is delayed too long, the consequences are rarely fatal. The consequences include sleepiness, lack of focus, and eventual sleep. Urinating and defecating both could be consciously delayed up to when the bladder or rectum must involuntarily force excrement out of the body. The ability to delay could prevent unintended excrement during sleep or consciously from a distance or time to a toilet, both when and or, I forgot the R there, where it is not or may not be preferred. As you don't want to poop in your bed, you don't want to poop anywhere but in a toilet or pee. Involuntary actions and constraints not biologically necessary could include external and internal causes and constraints. External constraints include gravity, walls, captivity, and confinement, as I said before. Internal constraints include threats, ethics, unawareness, skills, talents, influence, money, and other resources. Loss of free will. Without will, free will is not possible. Of course, Conscious will is not possible during sleep, unconsciousness, coma, and after death. Hypnosis and hypnotic drugs both could cause some loss of free will. Not necessarily a total loss. Hypnotists call loss of free will suggestibility. Some people are more suggestible than others, including children. Children are the most suggestible because they have the least competence of making judgments. Hypnotic drugs include ethanol, sodium, thiopental, scopolamine, and some other ones that I am unfamiliar with and don't to talk about in this one. I personally know or knew of many heavy ethanol drinkers and alcoholics while drunk were very suggestible and behaved very differently than when they were sober. After sleeping off their intoxication, many heavy drinkers have amnesia and don't remember anything while drunk, commonly known as a blackout. Sodium thiopental is also known as sodium pentothal. It's a truth serum. Wikipedia states thiopental is still used in some places as a truth serum to weaken the resolve of a subject and make the individual more compliant to pressure. Barbiturates increase both higher cortical brain function and inhibition. It is hypothesized that because lying is more mentally involving process than telling the truth, suppression of the higher cortical functions may lead to uncovering the truth. The drug tends to make subjects verbose and cooperative with interrogators. However, the reliability of confessions made under the thiopental is questionable. That's probably not be allowed to use as evidence in court. Scopolamine, I'm not sure how to pronounce it, also known as devil's breath, comes from a flower found in Colombia and Peru. One widely circulated story was about a victim who was unknowingly dosed, then woke up the next morning to find his apartment emptied of his furniture. He asked the doorman why the doorman didn't stop the theft. The doorman said the victim himself helped the thief load the truck. Summary. The previous evidences of free will are more obvious. During more routine activities, when free will is less obvious, the discretions and options to change how a routine is actualized, or the ability to consider and actualize other options concurrently while these routine activities, something we call multitasking, free will is evident. Please comment, like, and subscribe. Have a nice day.